One of the most common causes of sudden onset shoulder and arm pain can come from a pinched nerve in the neck. The joints, the discs, and the nerves of the lower neck can easily radiate pain into the shoulder, the elbow, or even the wrist and the hand. If you've ever suffered from this type of disorder, you can testify to how terrible this type of pain can really be. Burning, tingling, numbness, severe sharp pain in the arm, elbow, or hand. This can be pretty terrible for sure. Well, in this video, we're going to give you a few easy to do exercises to unpinch your pinched nerve. So Lily, I know you know a little bit about dizziness because you've helped us out on several of our dizziness videos. But do you know anything about a pain in the neck that can really get on your nerves?
Let me think about it. Mom, Luke stole the remote. Mom, where did Luke put my toy? Yeah, I think I know something about that.
Well, welcome back to another episode of Physio Tips with Mauro. I'm your host, Mauro Burnett, physical therapist and postgraduate physical therapy educator across the United States of America. For today's episode, we're going to discuss a pinched nerve. We're going to define what a pinched nerve is, and more importantly, we're going to talk about some easy home exercises you can do to start getting some quick relief in case you're suffering from a possible pinched nerve. I'd like to say, before we get into this, if you're getting value from this video, don't forget to hit the like button below, and don't forget to subscribe to this channel to receive more videos like this in the future on physical therapy related tips. All right, let's get into defining a pinched nerve. I've got a spine model with me here. And in the spine model, we have 7 neck vertebrae. And then we have these spacers in between the intervertebral, called intervertebral discs between the vertebra. And then we have these yellow things exiting the side, and those are the nerves. The nerves exit from a small tunnel where one bone sits on top of another. In certain scenarios, those tunnels could start to narrow, and that would pinch or put pressure on a spinal nerve. If you have bad posture and your head's forward, tight muscles could constrict and close that tunnel. If you have a herniated disc in the neck, that disc could kind of press into that space, and that could cause pressure onto the nerve. And also, the bones themselves become arthritic over time. We call that spondylosis. And calcium deposits build up, and it causes these kind of extra projections of bone, and that could go into those tunnel spaces, and that could cause pain into the shoulder, elbow, the wrist, or the hand. The whole arm could be a possible target for referred pain from a nerve in the neck. Now, if you have a true pinch in the neck that's completely pressing the nerve, that's what we would define as a radiculopathy. A radiculopathy can be defined as a nerve that's compressed that's causing a specific weakness in the arm that corresponds with that nerve. You might feel weak to lift your arm to put your deodorant on, or maybe to groom your hair. Radiculopathy also will cause a specific numbness along a part of your arm that corresponds to one of the nerves in your neck. And lastly, you might see reflex changes. Your reflexes will become less excited. You tap it and it just doesn't respond like the other side. So decreased reflexes, numbness in a particular pattern, and weakness in a particular pattern correlating to that nerve is what we would call a true radiculopathy. However, in many cases, you may have a pinched nerve and pain that's going down into the arm, but it's not necessarily fully causing a radiculopathy or weakness. It just causes a lot of pain in the arm. I've seen several videos all over the internet where some of the exercises, immediately the person is kind of leaning back into that pinched nerve as potential exercise. And oftentimes I notice for my patients, when the nerve can be really pinched and it's really painful, oftentimes the patient wants to kind of move away from the nerve to get away from the nerve. These same tunnels that we were talking about When I go back, let's say the pinched nerve is on my left side. If I lean my head back, oftentimes what I'm doing is the bones are starting to close down on one another and it's starting to close that tunnel, and we would call that a closing maneuver. It's closing down on that space. If I flex open, then that space kind of opens a little bit and it takes a little pressure off. So extension would be considered closing, flexion, bending forward would be opening. Rotating towards the pain would be called closing. It's going to close that tunnel. Rotating away from the pain would be an opening technique. So what I often do for my patients in a pain dominant case where it's real severe is we often will start with opening techniques to take pressure off that severe irritated nerve. And this can be a great idea for giving you some relief. So we're going to get into a couple exercises that I'll show you how you can open up that space and take a little pressure off your nerve. Exercise number 1, chin tuck. Exercise number 1 is going to be the McKenzie chin tuck. Oftentimes if my head is forward, again, it's going to close those tunnels and it could easily be a part of pinching the nerve with pain down in the arm. So the first thing I want to do is correct my sitting posture. If you're sitting on your tailbones, then you want to think of it this way. If you rock all the way back on your tailbones, that's one extreme. If you rock all the way off your tailbones, that's another extreme. So you want to find like a halfway point. Next, what you want to do is imagine if you had 2 fingers on your chin, you slowly draw your chin away from your 2 fingers as if you were making a bit of a double chin. It's important that your head doesn't tilt back. Remember, we mentioned tilting back closes that space. That can be irritating. We also don't want it to overflex forward. I simply want it to go straight back in line like I'm making a double chin. The amount of time that you hold it is just long enough to think to yourself, pressure on, pressure off, pressure on, pressure off. And we would repeat this 10 times. Pressure on, pressure off, that's 3. Pressure on, pressure off, that's 4. Pressure on, pressure off, that's 5. Pressure on, pressure off, that's 6, and so on. This can easily be done every 2 hours throughout your day as long as symptoms persist. What we're looking for is called centralization. The symptoms that were going into your shoulder, your arm, if we do this correctly, you should start to feel less pain in the arm and the pain maybe starts to travel closer to the neck. That would be a desired outcome. If it makes your symptoms worse, of course, disregard and don't do it. That's going to be consistent with all the exercises that we're going to show you. However, it's worth giving it a try. It's easy to do, and it's been proven to be effective for lots of cases in the past. So that's exercise number 1, the McKenzie chin tuck. Exercise number 2, fist traction. Exercise number 2 is going to be called fist traction. This was created by a very famous physiotherapist from New Zealand called Brian Mulligan. And the way this works is I put my hand, I make a fist in this little hole here. That's where my chin's going to go. So I put it on my chest, drop my hand down, I reach over, and then I give myself a little bit of overpressure into flexion. Hold it for 6 to 10 seconds, and then I relax. The idea with the fist is the fist prevents me from overflexing my neck too far. So it creates a nice scenario where the vertebra in the back of the neck will open up nicely. So in a scenario where maybe you had more pain flexing forward, this would be a great exercise. Place it here on your chest, bring it forward, hold it for 6 to 10 seconds. You could easily do that 3 to 5 times. And again, this could be done every couple hours as needed. Give it a try. When you're done, reassess. Okay, now I can flex further. And by the way, it doesn't feel quite as burny or painful in the arm. So that could be a nice technique to open up those tunnels. Let's get into exercise number 3. Exercise number 3, opposite rotation with assist. Exercise number 3 is going to be an opposite rotation with an assist. We mentioned earlier that if my pinched nerve is on the left and it's hurting into the left arm, If I rotate into the pinch, oftentimes that's the provocative, painful position. So rotating away from the pinch opens the tunnel, let's say out of your 7 vertebrae, maybe it's pinched between C4 and C5. Then rotating away has the ability to open that tunnel. So sometimes in a non-provoking, non-painful way, I could gently rotate and maybe do that 5 or 10 times away from the pain, pause for a second, and kind of analyze how your shoulder feels. If it's starting to help, that could be a great technique. Moreover, I've got a mulligan neck cervical strap. We'll put this in the description of the video, maybe how you could get one of these, but they're not too expensive, maybe $15 or $20. And what I'm going to do is place this over the lower part of my neck, right where it feels maybe the most painful. The middle to lower part of your neck is going to be about where C4 and C5 is. And then what I'm going to do for this strap, instead of holding right hand, right strap, left hand, left strap, I'm going to drop this strap and I'm going to crisscross. My right hand takes the left part of the strap. I'm going to kind of grip that area and I'm going to pull slightly up at a 45-degree angle. Then what I'm going to do is as I rotate to the right, I'm going to assist with this strap. And what it's doing is it's really being specific and isolating to that level to open that tunnel. So this could be a nice exercise, 6 to 10 reps, to really specifically open up that particular area. Wait for a minute, see how your shoulder feels. Hey, that's starting to feel a little bit better. You're starting to relieve. This could also be done with a small, medium-sized hand towel as well. You could use the sewn edge of the towel, put that behind your neck, and then do the same thing. We've demonstrated that on a few of our previous videos. But that's a wonderful technique. Opposite rotation, open up that tunnel, take a little pressure off that nerve, give that nerve some breathing room, and that could be a nice technique to start getting some quick pain relief on that shoulder. Now let's get into our last exercise. Exercise number 4, median nerve flossing. Our 4th exercise is going to be called median nerve flossing. And this is one of the main nerves that comes out of the neck and travels through the arm. So the first approach we did was to work on techniques to open the tunnel to start to relieve pain on the neck. Now what we're going to do is we're going to do a technique to gently floss the nerve that comes out of the neck through the arm and hand. And as we gently move the nerve back and forth, there's tunnels that the nerve travels through the arm. As we move that nerve through those tunnels, oftentimes it can start to free up adhesions and allow your arm to feel more comfortable as you stretch it out. You might notice reaching back to get your seatbelt is very uncomfortable and can cause pain and tightness in the arm. If that's the case, we start with our opening techniques, and now what we're going to do is some gentle nerve flossing. In the past, decades ago, they tried to do what was called nerve stretching. They found this to be very painful. It didn't go very well, and it almost drifted into obscurity. But then in the recent past, these techniques have been resurrected, but now in a much more gentle form, and now we call them nerve flossing. Gentle flossing or moving the nerves back and forth have a way to improve nutrition to the nerve and allow nerve healing. They also decrease pain. So this is what we're going to do. We're going to take my hand, I'm going to put it on this side. I'm going to hold my upper trapezius down gently. That's going to hold my first rib down. It's going to open that tunnel for the nerves to exit. And then I'm going to take my hand. As I move my wrist this way, it puts a little tension on the nerve at the wrist, but I also move my head to the left, which then takes slack off of the nerves at the neck. I now do the opposite. I move my neck to the right, which puts a little pressure on the neck as far as stretching the nerves, but it takes pressure off the nerves by moving my wrist this way. So I go pressure on at the wrist, pressure off at the wrist. Pressure on, but pressure off at the neck. Pressure on at the neck, but pressure off at the wrist. And you would do this process. You can start to stretch your arm out as you do it as well. And we would do this maybe 10, 15 reps. Keep it pain-free. Don't stretch into the pain. Stay shy of any pain. And after you've done this, you can easily try this 3 or 4 times a day as needed. But what you should notice when you're done is your arm feels a little more flexible. You now can start to move your arm and reach in directions without feeling so much pain into the arm. Well, thanks for watching today's video on how to unpinch a pinched nerve. Hope you enjoyed it. Don't forget to hit that like button below or share it with a friend if you know a friend suffering from a similar pain disorder. Remember, you can always subscribe to our channel to receive more videos like this in the future. Thanks for watching. It's goodbye for now, and we'll see you next time on Physio Tips with Morrow.
You stared at me weirdly.
So Lily, I know you know a lot about dizziness because you've helped us out on several of our past videos. But do you know anything about a pain in the neck that can really get on your nerves?
Wait, what was I supposed to say?
Then you go, So Lily, I know that you know a lot about dizziness because you've been in several of our dizziness videos. But do you know anything about a pain in the neck that can be... Oh, cut.